Hello everyone, welcome back to Let's Talk Psychiatry. I'm Sachima, your host, and today we're going to talk about the treatment of schizophrenia. In the first two videos, we discussed the disorder, schizophrenia, and talked about the signs, the symptoms, and how they can present. Now in this video, we're going to talk about the treatment of schizophrenia. The treatment is usually lifelong. It involves a combination of medications, psychotherapy, and coordinated specialty care services. Some patients can be hospitalized for purposes of diagnosis, for medication modification, and for stabilization as well as safety because of suicidal, homicidal, disorganized, or inappropriate behaviors. Pharmacotherapy includes antipsychotics, which reduce psychotic symptoms and reduce relapse rates. The medications work by blocking dopamine receptors in the brain. They are categorized into two main groups. The first is the first generation, including haloperidol, chlorpromazine, and fluphenazine. The second is the second generation, including clozapine, olanzapine, and risperidone. We're going to talk about this in a later video. Now we talk about the phases of treatment. We have the acute phase, where the patient is agitated and has an ongoing psychotic symptom. Here, the patient requires immediate attention and can be given intramuscular injection for calming effects. We have the maintenance phase where the patient is in remission. The goal here is to prevent a psychotic relapse and to improve the level of functioning. Non-compliance occurs when patients don't follow recommendations by taking their medication. About 40 to 50% of patients become non-compliant, and compliance is increased when a long-acting injectable is used instead of oral medication. So when taking this long-acting injectable, we have to supplement with oral to increase the peak plasma level of the medication. Psychotherapy includes group therapy that focuses on real-life plans, problems, and relationships. We have cognitive behavioral therapy, CBT, done to improve cognitive distortions, reduce distractions, and correct errors of judgment. We have personal psychotherapy, which enhances personal and social relationships. We have dialectical behavioral therapy that combines the cognitive and behavioral theories aimed at improving the patient's interpersonal skills. Other therapies include the electroconvulsive therapy, ECT, where electrical shock waves are transmitted throughout the brain. We have an organization called the National Alliance on Mental Illness, NAMI. This organization offers emotional support to family, to friends of patients who are mentally ill, and for patients themselves. We also have the ACTS, Assertive Community Treatment Team. Is an intervention that provides treatment and rehabilitation and support, like home delivery of medications, monitoring of mental, physical health, and frequent contact with patients and their families. Here, a patient is assigned a multidisciplinary team comprising of a psychiatrist, a nurse, a general practitioner, a case manager, and so on. So we're going to talk about medications in a separate video called Let's Talk Pharmacology in Psychiatry. Look out for that video. Thank you.